Good morning, everyone. I represent the 5-star toilet team, and today I'm going to present an overview of our intervention and the results. Our study was a cluster randomized trial which had 97 clusters, 47 in intervention and 47 in control arm of the study. This study was conducted in 3 blocks of Bhavnagar in Gujarat. So we conducted a household listing exercise, and from the household listing we conducted stratified randomization and allocated 47 clusters to intervention and 47 clusters to control arm. 10 households from each cluster is where we conducted the baseline study, but those households were excluded from the follow-up evaluation. Out of the 47 clusters, we conducted 47 clusters in each study arm. We collected qualitative data from 2 clusters from each arm. And at endline, we evaluated the campaign through a self-reported questionnaire survey, which included standard measures that all TW14 teams reported on. And we also used an alternative tool, which was basically a physical activity survey, which had one question on toilet use, but that question was masked. So the respondents did not know that we were doing a toilet use survey. The data was collected by 2 different teams, and they were kept blind to the allocation. Our study used the behavior-centered design theory of change. Behavior-centered design uses design thinking to design and deliver its intervention. So it uses both the psychological, it addresses both the psychological and the environmental determinants of behavior. What you see on the outside are the steps that are followed to design, deliver, and evaluate an intervention. And what you see in the middle of the figure is the theory of change. So an intervention, introduces changes in the environment of the target behavior, and exposure to this environment causes or influences the psychology of the target population, which influences them to change behavior. So that's the theory of change. The process that we followed to design our intervention was based on the behavior-centered design theory of change, and the process that we followed is popularly known as the double diamond process, which we adapted, and we call it the triple diamond approach, which includes the first 3 steps of the behavior-centered design, basically assess, build, and create steps. So as you see in this particular figure, we started with initially listing what all do we know about toilet use. So perceptions of the team that was present in the room, which included the implementing team, the research team, and also the design team. So we listed some commonly known or commonly known insights and perception. Then we delved into literature, which included both peer-reviewed literature and also experience from the field, because often a lot of interventions do not make it to peer-reviewed journals. So we looked at both literature plus experience and whatever was known about, and then we came up with like a larger list. So we started with habit, shame, knowledge, norm. These were the key determinants of factors, maybe enablers or barriers. But then we came up with a much larger list, which included more number of items like manners, shame, knowledge, dignity. From this, we organized them into something called the BCD checklist. It's a behavior-centered design checklist, which has some predefined categories. We organized this checklist, and then we looked at further identifying or prioritizing key or the key motives or key ideas that we could use for the campaign. So we did an exercise where we ranked them according to power and relevance to the context in Gujarat. From this exercise, we also came up with some additional questions which we really needed to investigate in the field. We conducted a formative research which included both quantitative and qualitative data collection, and it was done through different tools, games, toilet history mapping, and sleepovers in households with toilets. And from there we came up with, again, a much larger list, more insight on why people use a toilet or why people do not use a toilet. And that included, issues like, people had incomplete toilets. So the toilets were constructed, but some of them were not really functional. There were issues around convenience and comfort. People often said that we get a packed feeling. This is the word they use. We feel claustrophobic the moment we enter a toilet. It smells. It's not a very comfortable experience to use a toilet. Some mentioned that they were worried about safety of children, but some also mentioned that going out was risky, so we felt more safe and secure if you have a toilet at home. So we looked at a whole lot of motives or insights that we gained from this process, and again went back into a creative workshop where we kind of discussed these, we brainstormed on these ideas, and this helped in developing our primary hypothesis for developing the campaign, and also helped us in selecting the key motives that we could address through the campaign. That led us to the 4 key motives that we actually used for developing the campaign around modernity, comfort, convenience, and this whole issue of pit filling. So people were not able to estimate the exact time, or not exact, but also a rough time, what it would take for a pit to fill if the entire family uses it. So they were hoarding the pit space by not using it. This further led us to some creative insights and ideas. So one was basically so our campaign specifically targeted households with government or contractor built toilets. And one of the issue there was that some of them were really not functional. So one of the key areas that the campaign aimed to focus on was toilet makeovers, and to do it with minimum resources, not to suggest anything fancy in terms of inputs, but to make sure that all the issues that people had listed, we are able to address those. Also, we focus on comfort and convenience related to toilet use, status, affiliation, and we hope that this would also help in changing the norms around toilet use in the community. Now, the process did not end at this stage. Our design team again then went into the field to test various ideas. Some were tested at the concept level, like logos and all, and some were tested at the execution level. For example, the skit, to get people's insight and reactions real time, and then make modifications to those intervention. And of course, the creative team's involvement did not end up at creation of these products. They were also involved in monitoring the use of these materials by the facilitators in the field, and also to look at how the community is reacting to it. So the overall theme that emerged from this campaign was that the world is getting smarter, and smart people build smart toilets. Now here we looked at developing a new narrative around sanitation, to not talk about it as something which was disgusting, but something which was more desirable, and for which people could feel proud of. So we talked about the 5-star elements of a smart toilet, and in the 5-star, each star stood for an aspect of comfort, aesthetics, and inclusivity. So basically we had a checklist and a assessment sheet, and we gave people stars, and we said, okay, why don't you rank your toilet to see if it has cross ventilation. If it has cross ventilation, then you get a full star, but if it has only one vent, then you get half a star. So this was an exercise that was followed. On this slide, you see the theory of change. I mean, the colors have changed a bit, but the light green are the intervention components. So basically, we started with assessment of 5-star toilets. We also introduced them to toilets from different parts of the world. And during tea break and lunch break, I would invite you all to visit all the stalls. And the first one here on the left is the 5-star toilet stall. So you'll be able to see what campaign materials we had used. We also created films to address comfort and convenience issues. And those films are available on YouTube, and we can always provide you the link. And we also address the whole anxiety around pit filling by talking about, how much time does it take for a pit to fill, and we delivered it through interesting and interactive community games, and something we call as emo demos, where we did some demonstrations and asked people to guess that how much time it takes, or reduce the anxiety around pit filling. The intervention delivery basically took place over 2 days. So we started with some preparatory work by seeking buy-in from the community. On day one, events were held during the day and there was an evening event. Then there was a gap of 4 weeks between day one and day two, in which the volunteers were supposed to, there were volunteer village volunteers who were to follow with people who had enrolled for 5-star makeover. And day two, where we addressed basically the pit-filling anxiety, and we also felicitated households who had conducted the 5-star makeover. Here are snapshots from the street events, and all of this material is available. I'll invite you to just view that. Now we come to the results. As you see, we achieve good balance across both arms, except for male education and asset, and we had decided to adjust for these in the analysis of outcomes. The intervention showed some increase, but it was not as per what we had expected. So after adjusting for imbalances, there was a 5-point prevalence difference between intervention and control arm of the study. We also used an alternative questionnaire, alternative method, which was the physical activity questionnaire, where one question on toilet use was camouflaged. And there we saw 4.4% less reported use of toilet. We conducted a process evaluation, and we realized that, project timelines were shortened. Therefore, it was difficult to engage volunteers who were supposed to do follow-up in the communities. And also we realized that, participation of women was really limited in the evenings, because, often it was a busy farming season, and in the evenings they were busy cooking for the family. And by the time they got free, it was really late. And in some communities, women were really not encouraged to come to the village center at night. Villages were spread out. Seasonality and farming season were some of the reasons why the facilitators of the campaign found it really difficult to engage communities. The intervention was modified in the initial stages, but then it was implemented as per plan. Only 14% of the intervention household had heard of the 5-star toilet. So there was fairly low coverage, and but intervention households more often reported having heard of or attended events as compared to the control arm. We saw overwhelming response in terms of the 5-star toilet concept. So there was huge number of people who enrolled for assessment of 5-star toilets, and on day one, 362 families were actually awarded a certificate and a sticker which was pasted on their toilets, and 718 households had committed to improving their toilets, out of which 177 actually were awarded a certificate on day two, and 693 families were their photographs were displayed on the village board, which is right on the left hand side. In terms of response and acceptability, there was 6 percentage point higher agreement between intervention household, with the statement that if a household has a toilet, then people will regard it as modern or smart. And participants in the intervention arm who were exposed to the 5-star toilet intervention reported higher toilet use as compared to those who were not exposed. So as we see, the campaign tried to build a new narrative around toilet use. We also looked at, an alternative tool to assess use, but of course the toilet coverage was low, so we don't know whether the campaign works or it doesn't work. But of course, it cannot be excluded that, if an intense version of the campaign is delivered, then maybe we may receive some other results. So what do we recommend? Well, there is a need to continue focus, and as Bethany also mentioned in her presentation, there's a need to focus on maintaining toilets and behavior. So there's a need for behavior change to continue going forward. Intervention design, which is basically the methods and the material, should be based on estimated population. We looked at a population which had government-built functional toilets. So we were basically, with the higher increase in toilet coverage in Gujarat in recent years, we were actually looking at a smaller proportion of the toilet population. So maybe not community events, maybe much more intense engagement would have helped. There is a need to develop and test newer tools for assessing toilet use. And of course, changing behaviors take time. So there is a need for sustained investment and of time and resources. And of course, there's a need to develop designs which engage the community and engage people. The campaign was led by London School of Hygiene with Indian Institute of Public Health Gandhinagar as our local technical partner. The creative process was led by the Upward Spiral team, and intervention was implemented by the Coastal Salinity Prevention Cell. Although the campaign did not show an impact, but we had another kind of impact. The government of Gujarat, especially the district government in Bhavnagar, has expressed in using this campaign in other additional block in 50 villages. And we've also had interest from the Tata Trust. They would like to use this campaign in some villages in Gujarat and also in other states where they are intervening. Thank you so much. And we'd like to thank 3IE RISE and the Gates Foundation, and special thanks to Neeta and Radhika for all their support through this process, and all the collaborators, and of course Government of Gujarat for their interest in the campaign. Thank you.